Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafidi, and welcome back to our Healthy Living edition of KUAM News Extra with Dr. Lom. And we're now taking your questions. Our first question comes from Denise, and she asks, do you recommend black cohosh for hot flashes?
You can use black cohosh. That is a herb, the root of a plant that's found in northern climates in Europe and in North America. Black cohosh has some phytoestrogen in it. Phyto means plant, estrogen is of course the hormone. So by taking black cohosh you increase levels of estrogen in your body. And this is used quite frequently in Europe, especially in Germany. You can use it with caution, especially if you are if you're a breast cancer survivor or if you have a strong history of family history of breast cancer, then you should take it with caution. But otherwise, it's something worth trying. You can take anywhere between 40 milligrams up to about 500 milligrams per day safely. And as long as you've had a normal mammogram and you don't have any problems with your uterus, you should be fine.
And this is something you can get locally?
You can buy it in a vitamin store or over the counter.
Our next question is from Jen L. from the village of Dededo. She asks, what is surgical menopause?
Right, so menopause can occur suddenly if you have surgery on your ovaries. For example, if you had cysts on your ovaries or unfortunately had ovarian cancer, or sometimes even surgeries around in that area on fibroids or other parts of the uterus may affect the circulation to the ovaries and cause them to go into premature failure. Of course, if they've been removed, they can no longer be producing estrogen for you. So you would go into menopause much earlier. That becomes quite a challenge for women who've gone through that because their symptoms tend to be very severe and they do generally need hormone medication to help them through that.
Our next question comes from Barragata Heights. Tanya B. asks, would you recommend hormone replacement therapy, HRT, to treat menopause or premenopause?
Well, I think the important thing to remember is that premenopause and menopause are natural, normal conditions that we go through just as we go through adolescence when we're young girls. So there's no need to treat these conditions unless they are bothersome to you. In fact, if you have some sort of unpleasant symptoms. So if you are having hot flashes or insomnia or irritability, terrible anxiety or inability to function in some way, then you need some help. Otherwise, you can just exercise, live a healthy life, and get through it.
Andrea from PD asks, how long can menopause symptoms last?
They can last a long time. Average length of time is about 4 to 5 years for women, but they can last even longer than that. In that case, sometimes ladies will like to have some medicine to help them.
Okay, and our next question, can I become pregnant during perimenopause?
Yes, you can. Perimenopause is the time, again, between ages about 40 to 50 or so. The chances of pregnancy are much lower in that age group. Women are much less fertile, especially after age 45. The chance of getting pregnant is very, very tiny, but it can still happen. This can be tested with a blood test to see where you are in your fertility, but caution still should be taken up until about age 45.
Earlier, Andrea from PD asked about the symptoms of menopause. Aguaran now asks, how long does menopause usually last?
On average, about 4 to 5 years.
All right, well, thank you so much for joining us. Make sure to join us again next week for another sit-down interview with Dr. Lom. Next week's topic is hair loss, so post your questions on KUAM.com or on our Facebook page. Stay tuned. We're back with more news and a little extra after this.